I'm Dr. Adrian Dreesen. I've been an emergency physician practicing for just over 21 years, and I'm an emergency doctor here at Brookings Health. Anything that's on more what we call the acute side, meaning, onset of acute symptoms that happen quickly within, minutes to hours are probably the most important things, whether it be chest pain, shortness of breath. The problem is we've all seen patients that have minimal things up front that have something terrible, and also have seen patients who have horrible symptoms but have all normal tests. But I think if you feel like there's something worrisome going on, I think you should be evaluated. There are situations where patients have more minor symptoms, and even though to the patient it may feel like, oh my gosh, this sore throat is the worst thing I've ever had, but if you're swallowing okay, you're not having difficulty breathing, you may have time to then either make an appointment with your doctor at the next day clinic appointment or next time the clinic's open, or we have options in town of urgent care. The hard part about that, of course, they're not open 24/7 like the emergency, and so the time frame sometimes doesn't fit into people's schedules. For advice, I think you can always call your doctor on call if you have one, or whoever's on call for that provider that can potentially can talk to somebody. And then health insurance often has their own nurse advice line or some form of that maybe could offer some insight. That unfortunately is also a judgment call, but I think there are clear things that, somebody who's incapacitated, in so much pain they can't move, if they're passed out and, or unconscious and need immediate help. I think likely like seizures are an important one, and then traumatic injuries are also, if you come upon an accident, I think it's always helpful to get the most experienced trained personnel around those sort of patients as quickly as possible. The quickest, if somebody truly has a medical emergency, the quicker you can get to a trained person who knows what to do next, the better. The hard part, say stroke or heart attack or trauma, if somebody chooses to drive farther away, if they become unconscious or something terrible happens, such as a respiratory arrest or a cardiac arrest, then you're stuck in a car with nobody to help at that point. And you'll probably be calling 911 at that point anyway. And so I think those are the most important reasons why. Would you rather have an ambulance bring you 5 minutes away or 50 minutes away to get that care? Everybody likes to have care in their community, as close to home, with friends and family or people to help kind of take care of either what's happening home or what's happening at the bedside. I think the ability for us to take care of anything that comes in the door helps patients have peace of mind in our community that if something happens, we're here to help take care of them.